Do you ever feel vaginal discomfort, low sexual satisfaction, or even experience leaking when you laugh, sneeze, or cough? You are not alone. Millions of women face these struggles in silence. It's frustrating, embarrassing, and it might feel like there's no solution. But here's the truth. The power to transform your intimate health lies within you, through pelvic floor exercises, Kegel exercises, and embracing the right guidance with pelvic floor therapy. Stay with me, and let's reclaim your confidence. Hi friends, Dr. Emily here, an OBGYN here in the US, and a straightforward voice of science-backed truth here on YouTube. Today's episode of Vagina Health 101, we're talking about the small but mighty group of muscles supporting your bladder, uterus, and bowel, and how simple Kegel exercises and a consistent pelvic floor workout can improve control, confidence, and comfort. What is the pelvic floor and how it impacts on the vagina and sexual life? The pelvic floor is a hammock of muscles and connective tissues at the base of your pelvis, supporting critical organs like the bladder, uterus, and vagina. When strong, these muscles keep the vagina in place, maintain tone, and enhance sensation during intercourse. But if weakened, due to childbirth, aging, or hormonal changes, the vagina can feel loose, which may reduce sexual pleasure and intimacy. Medical experts affirm that pelvic floor dysfunction affects up to 50% of women at some point in life. Beside that, you might notice urinary leakage, pelvic heaviness, or even prolapse. The good news? Just like other muscles, these can be trained, and the most famous move is the Kegel exercise. It's a targeted squeeze and lift of your pelvic floor muscles, and it's the foundation of any effective pelvic floor workout. So, how to improve and restore? Here are proven practical strategies. 1. Imagine stopping the flow of urine midstream. That's the muscle group you're activating. 2. Squeeze and lift for 3 to 5 seconds, then relax for the same amount of time. 3. Do 8 to 12 reps, 2 to 3 times a day. For variety, add quick squeezes, 10 fast Kegel exercises to build endurance. If you're not sure about your technique, a pelvic floor physical therapy session can be a game changer. To get the most from your pelvic floor workout, practice in different positions, lying down, sitting, and standing. Pair the squeeze with your breath. Inhale to relax, exhale as you lift. Add functional moves, bridges, squats, or yoga poses that engage your pelvic floor for women. Be consistent, just like brushing your teeth, daily practice works best. Avoid common mistakes like holding your breath, squeezing your abs or thighs instead, or overtraining. And remember, even Kegel exercises for beginners can produce results within weeks if done correctly. For tight or overactive pelvic floor muscles, stretching with cat-cow or happy baby poses can help relax and rebalance. These simple moves, when practiced consistently, can dramatically improve sensation, urinary control, and overall comfort. That's why pelvic floor exercises and Kegel exercises are essential. They strengthen, lift, and restore function. Now, here's a tip from pelvic health professionals. Combine pelvic floor therapy with feedback, like biofeedback or guided instruction. This can double your improvement rate compared to DIY alone. Aim for shorter sessions, 10 to 20 minutes. More frequently, 24 sessions over 12 weeks. Research shows better outcomes that way. And don't delay seeking help. Many women suffer in silence for years before care. Let's recap. Strengthening your pelvic floor with Kegel exercises, pelvic floor exercises, and professional pelvic floor therapy can restore vaginal tone, heighten sexual sensation, and resolve leakages. You deserve intimacy without discomfort. If you found this helpful, hit like, subscribe, and ring the notification bell so you never miss a tip. Share this video to empower other women. Try starting with a simple Kegel or pelvic floor stretch today. Commit to consistency, and you'll feel the difference. Ready to redefine your comfort and confidence? Let's get started. See you in the next episode of Vagina Health 101 by Dr. Emily.